I'm Dr. Ira Chasnoff. I'm at Children's Research Triangle in Chicago and also a professor of clinical pediatrics at the University of Illinois College of Medicine. We have a large program for children, a clinical program for children at Children's Research Triangle. We see close to about 1,000 children a year, almost all of whom have been prenatally exposed to alcohol and illegal drugs. My new book, The Mystery of Risk, the title really intrigues me. It is a mystery. When we talk about risk, there are so many factors that come together. If we're talking about children exposed to alcohol, they not only have prenatal biological changes that occur in the brain, but also many of them are exposed to significant trauma and separation once they're born. So those postnatal factors. And what I explore in the book is this question of where all the difficulties come from. Is it biological, environmental? And the other important aspect of this is that it's not all risk. You know, what promise do the children bring to their long-term development? So we look at both sides of the question, risk and promise, from multiple directions. So often when I work with parents, I have to help them put children's behavior into the context of normal. And I give several examples where families have come to our center with complaints and concerns about one thing or another. And when we evaluate the child, we find it's actually normal behavior. So one of the things I want parents and professionals to understand is we don't want to label children just because they were exposed prenatally to alcohol. Doesn't necessarily mean that every difficulty parents are having is due to the alcohol exposure. The last chapter is something I call the good enough syndrome. And the good enough syndrome is based in the idea that, well, we'll do this much, we'll go this far, but because of financial or political reasons, that's good enough. We don't really need to go all the way for children. And so the last chapter of the book, The Good Enough Syndrome, discusses that mindset.